I'm Marissa Johnson, CEO of ABC Medical Center. Today I will be presenting to you all of the new EHR solar system that will replace our current EHR system and why it will be so beneficial to the company. So you're probably asking, why do we even need a system? Well, this new EHR system will have many benefits for both healthcare workers and for the patients. More features will be available, such as easier ways to send information to patients, doctors, nurses, and other healthcare workers. Finding information will be much more straightforward, as there will be more options to personalize your home screen to better fit what each individual person wants, and there will also be a new messenger system in place that will make it easier to speak to doctors about medication changes, order changes, or if you have an immediate concern about a patient. This messenger system can be both on the computer or in an app that doctors, charge nurses, and house supervisors can place on their work phones that they carry with them. The new solar EHR system will also provide better functionality overall, as the loading times will be less, and there is now a new function that comes with this EHR system that when there is a system downtime, they will not have to revert to paper charting and have to back chart when the system comes back online. We all know how annoying that is. Instead, there is an additional feature called solar downtime, where the staff can still see what medications are due and what medication are available, and they can still scan the medication to ensure that they're giving the proper dosage. You will be able to continue to document and chart on the computer, and when the system comes back online, all that needs to be done is to transfer all the information from the solar downtime to the actual solar EHR system. This is one of the biggest changes that I'm excited about, because our old EHR system, we would have to revert and back chart, and it was just a giant hassle. So I feel that this will benefit all of us because it will lessen the interruption of patient care and will lessen the chances of errors. Another one of the big benefits of this new EHR system is that it focuses more on patients becoming more involved in their care. We all realize that social media is a big part of everyday life, so being able to be in contact with patients, not just through phone calls, but via texting, emails, or a phone app, is going to be a big step in patient compliance. Cardiac problems and COPD are some of the most prevalent diseases in many patients who come into the hospital. So being able to send them information about smoking cessation, pulmonary rehab, cardiac rehab, or the importance of medication compliance, and the importance of having a healthy diet could help improve patient health overall. There is also a new system called MyChart. It is either on the computer or via an app. It is a very convenient tool that patients can access, and it does all of the things you see here: schedule the medical appointments, view healthcare summary, etc. With the solar EHR system, our hospital will now be able to let patients access their MyChart and be able to do all of the things that they need to do. It will give us a better way to communicate with patients when they have any questions, comments, or concerns with the hospital, that involves their care, their medication, specific treatments plans that they may have heard or seen on a commercial and just want to talk to the doctors about, or if they want to be referred to a specialist. MyChart is only one of many mobile apps that have become available for patients to use on their phone. Other apps can help them with their nutrition, their medication management, health management like diabetes, pregnancy concerns, mental health, medication appointments, or resources that they can reach out to. Or there's the option for telehealth. So instead of coming into the doctor's office, they can stay home and either have a phone call or a Zoom call over their phone or their computer. The solar EHR system has the capability to send patients push notifications on these apps, send them emails, or send them a text message for anything that they may need, like appointment reminders, medication refills, changes to their medication dosages, or their lab results. They can also access their lab results if they need to take them to any specialists or if they just want them on hand. So that has been my presentation on this new solar EHR system. Thank you for taking the time to listen to this presentation. I hope that I have explained the most important parts of this new EHR system. Changes are always difficult, but we as healthcare professionals are used to thinking on our feet and thinking critically. I know that this new system will not only make patient care easier and more effective, but it should help patients have less hospital visits when they can contact healthcare professionals on their phones or computers. Thank you.